of these at the same time. Feeling for pulse, listening, looking for breathing. Okay? Okay, you're going to look at the chest. Okay, you come nearer to the head. Okay, you try. Very good. Okay, look at the chest. Can, but it will block the view a bit. Anyway, both sides also got. So, at this point of time, the examiner is going to say there is no pulse, no breathing. So what you're going to do? Start CPR. No pulse, no breathing. Start CPR. Okay. I want you guys to come. You guys to look closely. Okay. You all can come closer a bit. I'm going to teach you how to do it. Your dominant hand at the bottom. Your non-dominant hand on top. Okay. There's a breastbone here. Okay. You want to do at the half of the breastbone, at the lower half of the breastbone. Okay. You're going to put your hands like this. Okay. Females it will be difficult lah. You just aim at the lower half lah. You cannot use the nipple line. If males, you can use half of the nipple line lah. Okay. So you're going to do this. All right. Your elbows are going to be straight. Your shoulder is 90 degrees downwards. Don't do like this because you will get back pain. Okay. You're going to use your power of your shoulder and press down. Do you hear that click? That means it's effective. Okay. When you press, remember I told you to release. Press, release, press, release. You don't want to do this. You see, this is no chest recoil. That is wrong. You're going to do baby shark. Baby. So yeah. So you follow in your brain now. Okay, so that's how fast. You don't do very fast because what happens if you do very fast? You get tired. When you get tired, your effective rate is going to get low. Alright? So before we move on to this to see how you do, there is 5 things that the examiner is going to ask you. Confirm. Okay, what are the 5 qualities of high quality CPR? So first 1 and 2 is push hard and fast. So how hard? 1/3 or 5 cm. Okay, good. How fast? 100 to 120. Number 3 is to ensure chest recoil. Number 4 is minimize interruption less than 10 seconds. Number 5 is when you give breath later you will learn to give over 1 second. But to put it very simple is avoid excessive ventilation. So you just give over 1 second. Okay. How many chest compression you're going to do? 30. 2 breaths. How many times? 5 times. So you're going to do 32, 5 times. You don't do 32, then you start checking again. No. You do 32, 5 cycles, which equivalent to around 2 minutes. And then only you check back the pulse and breathing together. Then the whole cycle will continue again. You got pulse, got breathing, then later on you will learn how. Okay, so 5 things, remember, push hard and fast. How hard? 5 cm. How fast? 100 to 120. Number 3, ensure chest recoil. Number 4, minimize interruption, less than 10 seconds. Number 5 is avoid excessive ventilation. How many chest compression? 32 for 5 cycles or 2 minutes. Okay? Alright? Okay, so each one of you, the first person, show me how you do 30 chest compression. Count yourself. Okay? Ken, the one that is doing at the side. Yeah, start. Count 30 yourself. Very good. Very good. Very good. Yeah. Very good. Definitely good. Very good. Ada bunyi dah. Macam ada dalam sikit. Okay, good. Yeah. Very good. Now very good. Okay, dah 30. Okay. So you get a feel of it tak senang actually. Okay. Can. So everyone stop. Okay. So now after 30, I'm just going to show you, but don't do it in the mannequin. If it's mouth to mouth, you're going to close the nose a bit. You're going to lift the dongak kepala, angkat dagu sikit. Head tilt chin lift. You're going to Why? Because this opens the airway. Okay, you're going to angkat the dagu and then give 2 breaths. 1. How you know it's effective? You're going to see the chest rise. Then only you know. If the chest is not rising, that means the airway is blocked. Then you try to tilt the airway a bit. Okay? So we're not going to do this on this mannequin because it's photo. Okay, we're going to use a back mouth mask instead. Okay, so everyone can open this. I'm sure that you won't see this in your life after this. Okay? But we're just going to use this. Okay? I'm going to show you how to do this with it. Remember, if this pocket mask or breath, it will be at the side of the patient. Remember? If you use this, it will be at the head of the patient. Only in today's training, I will allow you to move the patient. Because in real life, you're not going to move him. You have to go to the front. That's why it's a bit more difficult. Better if two people. But we want to save our knees. So we're going to do this. Okay? The triangle is at the nose. Okay, put it like this. You see this? There's a C, there's a E. C, E. Okay? C, E. The C is on top. The E is at the kagu. At the head of the patient, kepala. Kepala. Okay? C, E. The E is to dongak kepala, angkat dagu. Okay? Put it a bit. Okay? You see this back? You want to give half a back.
Half a back.
Half a back for 1 second. 1, 2. Okay? That's it. Okay? 1. This one. Then you see the chest rise and that? Okay, this one is to make sure there's a seal so you press a bit and angkat dagu like that. Okay? 2. Alright? You want to try? Okay. C is?
Doesn't matter.
No, the head, this one must be at the nose, on top. Then you will ngam. This is the triangle kan. Okay.
The chest is breathing.
Okay. Halfway through, the examiner is going to say, okay, your friend dah balik dengan AED. Tapi dia tak tahu macam mana nak pasang. He don't know how to do it. So what you're going to do? Can we stop CPR and do? No. So what I can ask him to do? Continue the CPR. Okay. So what I'm going to do? Come. Bro, I don't know how. You don't know how to pasang, right? I'm going to help you. Okay. So can we take over the CPR? Yes. So I want to see the seamless moving. Okay. On my count 1, 2, 3. Okay. So that's how you minimize interruption. Okay. Don't need to do. You just put your hand here. Okay, we assume he's doing because I don't want him to pengsan. Okay, so what you're going to do is while he's doing assume he's doing, you're going to press the on button. Number 1. Here, listen.
If the patient is a child, press the child button.
So if the patient is a child, press the child button.
Remove clothing from the patient's chest. Remove packet and apply pads on the patient's clear skin.
You're going to put here.
Apply pad. Press pads firmly on skin.
Press pads firmly. So while all of this while he's doing the CPR.
Apply pads as shown in the pictures.
Okay.
Press pads firmly on skin.
In the center there's a sensor, so make sure it's contact with the patient.
Do not touch the patient.
Now only
analyzing heart rhythm.
Do not touch the patient, analyzing rhythm.
Do not touch the patient. Analyzing heart rhythm.
Make sure.
Shock advised.
Shock advice.
Do not touch the patient.
Do not touch the patient.
Everyone clear.
Everyone clear.
Press the flashing shock
button. Before I press, I make sure everyone clear.
Press the shock button.
Okay,
now.
everyone clear. I'm going to press now. Shock.
Shock delivered.
Shock delivered.
Begin CPR.
Begin CPR. So I'm going to do. Do you hear that sound? That's how fast you're going to go.
10.
10.
20.
20. Can you give breath? Okay.
30.
Okay.
Give 2 breaths.
1, 2. Okay. Like that. So you're going to do 5 times. Okay. So 30.
Replace batteries.
Okay, replace batteries is not part of it. Replace batteries tak ada termasuk lah. But you're going to do 5 times. Then you're going to say stop CPR, analyzing rhythm. Shock not advised. Then you, if it's not advised, you akan not advised.